everyone, my name is Kerry. I work here at Home Instead Southampton, and today I would like to talk to you a little bit about dementia and Alzheimer's disease. This is a complex illness, and we find that many people have a lot of questions, so hopefully I'll be able to answer some of those for you today. The reason that we do education on things like this is because it is a challenging journey, not just for the individual, but also for the family members as well. There are difficult areas to manage. There's the behaviours, there's the actual physical everyday tasks that become more of a challenge, such as personal care, and also engagement in family, but also in the community as well. And we find that a number of individuals lose a sense of self in that process. So this can kind of help you to keep those people engaged, so to speak. When we look at what dementia is, we think often that it's just one thing, but actually dementia is an umbrella term, and there are so many different forms. Commonly known is Alzheimer's dementia, or you have vascular dementia, Lewy body dementia, and there are so many others as well. And each one has its own signs and symptoms and processes and effects on the brain itself. Essentially dementia is a disease of the brain. We have our brain cells, we have our neurons, and we have chemical reactions that allow the neurons to communicate with each other. And what dementia does is interferes with those chemicals, which results in changes in memory, it results in changes in behaviour, mobility, sight, speech. People can even develop into having a completely different personality, but these are all as a result of impacts on the brain. Most people know that there are memory impacts with dementia, but that's very, very stereotypical. There are so many more parts. Memory loss is one of them, that is true, but there is so much more to it. The specific causes of dementia at the moment are not known. We cannot confirm exactly why dementia develops in some people and not in others, and we also don't know why the number is on the rise. But what we do know is that there are risk factors. There are risk factors in family history. Like with many other illnesses, we look back at family history and we find that there's often a link. Cardiovascular disease also has an impact. Cardiovascular diseases have an impact on blood supply to the brain, which impacts on oxygen, keeping the brain healthy. Because dementia is a brain disease, it's likely that that has an impact. Same as brain or head trauma. Again, we can't confirm that that's the case, but it's a possible factor that could contribute to why this develops. And other lifestyle matters as well. I think lifestyle matters impact on many aspects of our life, but also when it comes to keeping the brain healthy. The choices we make, the food we eat, the exercise we do, impacts on every aspect of our physical well-being, including the function of our brain. So it's important to make sure that we are supporting our loved ones to make good choices where they can with regarding the lifestyle matters and living healthy and being social and exercising and eating well. We will be including a link to a short video which explains really quite well the impact on the brain. But ultimately, these elements that you can see here, these are neurons, and this little spark here, that is a chemical connection which enables the neurons to talk to each other, and that's how we're able to speak and perform any daily activity. Because what happens is our neurons will transmit information to each other to give us the right information. And what dementia does is two proteins are created and they damage those neurons. So one protein, whether you can see it on here or not, damages the neuron from the inside. It gets it all tangled and starts causing clusters, and actually specifically damages the neuron. Then you have another protein which causes damage from the outside. So what it does is it blocks the connection in between the neurons. So even if you can recall that you need to tie your shoelace, for example, if that information can't connect to how you tie your shoelace, that is how you end up being unable to remember. The video to the link will help with your understanding on that and can explain it much more effectively. But ultimately that's happening all over. This is an example of one or two neurons, but there are thousands and thousands and thousands and thousands in the brain, all of which are all being impacted at the same time, but at different rates per person, individual to individual. Okay, so you can see the damage between the two cells there. The symptoms of Alzheimer's disease vary person to person, but commonly you do have memory loss. If you think back to the neurons, that does make sense. If we think of the shoelace example, that can be applied to anything. It does usually affect short-term memory loss before long-term memory loss. Okay, so if you have a loved one who has dementia, they might be able to tell you what school they went to and the name of their best friend and their first ever teacher, but they may not be able to tell you what they had for dinner yesterday. And that's because it's the hippocampus that gets affected first, and that is where our short-term memory is stored. Again, difficulty completing everyday tasks. The brain is being damaged and impacted by these horrible proteins which are building up and damaging our neurons, which means the things that we were able to do on a regular basis are now becoming much more challenging, alongside other elements of the aging process as well. You do get those with early onset dementia, and to be diagnosed with that you have to be under the age of 65 for that diagnosis. So if you have a diagnosis of vascular dementia or Alzheimer's, it means you're over that age, and there's going to be other elements that are impacting on your abilities and skills with familiar tasks as well. Challenges with planning and problem solving. Well, that makes sense if we think about the short-term memory. If we're struggling to take in that information and retain it long enough to use it, planning and problem solving becomes very, very difficult. Confusion with time and place. If you have someone within your life who has a diagnosis of dementia, that's something that you might start to recognise and is often an early indicator for family members that there's something going on and they might need to get some support with. Trouble understanding visual images and spatial relationships. Again, when you think back to the neurons, that makes sense because you can't necessarily get the information across from one neuron to another. Other symptoms, misplacing things and losing things and the ability to retrace steps. Now, it's perfectly normal for most of us to walk into a room and then go, I can't remember what I came in here for. And most of us do that. That doesn't mean that every single one of us has dementia. But what many of us tend to do is take a few steps back, start again, and we then often, or most of the time, can remember why it is we walked in the room or what we were doing there. Decreased or poor judgment, that can be on anything, that can be on people or circumstances or the environment. Withdrawal from work or social activities. Now this is a big one. If you are the person who has been diagnosed with dementia, or even without the diagnosis, you're starting to notice that you're forgetting things, that you're getting confused or misplacing things, the last thing you're going to want to do is head to a location, be it with family or work or whatever it may be, a social event, where other people might notice that, especially if you don't know what's happening or why. If you're going to have other people kind of observing you and noticing maybe odd things that you're doing, that's likely to create some insecurities, possibly a little bit of embarrassment as well. Changes in mood or personality, again, that's going to be tied in with confusion, maybe an element of fear, lack of understanding, a little bit of not knowing, possibly a suspicion and a bit of anxiety that if you go to the doctors, you might actually get a diagnosis of dementia, which most people don't want. Problems with speaking or writing, again, that makes sense when we think back to the neurons and the damage that the proteins are doing and interfering with the electrical charges, trying to make the two neurons communicate. There is a little bit of video here again, we'll attach the link for you. This is from a movie called Still Alice, which does give a very, very good representation of what it's like to be unable to remember certain things and the impact on that person. Not just the physical task or what's happened, but also the emotional side as well from the experience of that person.